Greetings. So, I had an interesting thing happen to me, actually yesterday and then today. Yesterday, I see an email coming from the Jocelyn Center. Jocelyn Center is where I go for the diabetes. Jocelyn Center works with the people who gave me, the surgery for my eyes. Other things happen. But anyhow, it's all affiliated with SUNY Upstate, which is right here in the city of Syracuse, New York. So I see that there's this bill for me for $660 and wants me to pay it. And it doesn't say anything else. I was too busy yesterday to deal with it. And it turned out it was a holiday anyway in some respects. So I waited until today. After I had an appointment with my podiatrist, I came home. I said, okay, time to knock this other thing out. So I get on the phone and I call them. And I get this lady on there and I said, yeah, I've got an interesting thing here. I got a bill online for $660. Would you check on that? So she looks it up and she says, yes, I see that there's an amount that's open, but you had that surgery a while ago, didn't you? I said, yeah. The one that wasn't paid for was in December. So we're 11 months behind. And it was early December. So you guys didn't rebill it. She says, well, I wonder what happened. There's no notes on it. Did anyone ever talk to you? And I said, actually they did, but I'm the one who started it. Because I called them when they tried to bill me the first time in January. And the thing is that I had to update information or verify information with my insurance carrier on January 1st. But I didn't know that. If I had known that, I would have done that earlier in December, but I didn't know that. So when I got hit with this $660, I called the insurance company. We had this conversation. They verified that, yes, it's still me and everything else they're supposed to do. And so the representative for the insurance company called you guys with me still on the line from home to tell them that everything is fine. This is how you're supposed to bill it. Thinking that should have been their process all along anyway. And all should have been closed. I assumed everything was done because it's November. The surgery was in last December. Had that first conversation in January. This doesn't work out right. And she says, well, I'm just surprised that there's no notes that somebody talked to the insurance carrier. I said, are there any notes saying that anybody billed the claim? She said, actually, no. And as someone who was in healthcare finance for a long time, that would have freaked me out, that nobody had ever sent the bill. You get reports monthly. Some places you get it weekly if you're doing bad, but monthly you get reports of outstanding claims. And you didn't bill this for all this time? So I said to her, well, this is the information. Do you guys have the insurance information? She says, no, we don't have that either. And I said, but you're connected to the Jocelyn Center, right? She says, well, yeah, we're kind of a separate entity, but yes, we're associated with them, upstate. I said, so when I have gone to the eye center for any kind of appointment whatsoever, they always verify the insurance. I was told it passes through to you. The November bill was covered, so they must have sent that to you. You guys should have had the exact same information. And she said, well, let me look at this. And then she goes into the portal. Now, here's the thing with the portal is that they actually have a page that talks about the insurances that everybody has. However, even though I still have insurance coverage with the same company, the numbers have changed since last year. As a matter of fact, I don't know why it happened, but it changed 3 times. I got another card in September with a totally different number overall. But for the number she needed, exact same. Nothing had changed with that number. So she looks at it and says, well, we don't have it. I said, but yeah, you guys got paid for November, right? She says, let me look at it. She says, well, yeah, it looks like you had it paid. So we talked and I gave her the number again And I said, well, I think that that's probably all we need to do. She says, well, yeah. She says, yep, we're going to try to, bill this and do whatever. And if it's not covered or if something happens, we will call the insurance company. I said, yeah, you guys have that thing on the portal where you just sent me something for $660. If I hadn't had to deal with that last January, I wouldn't have known what that is, because when I went to look at it, it didn't say anything. She says, yeah, well, we don't have, any authority over how the wording should change. I said, I bet your doctor does. And then that was it. But when I hung up the phone, I started laughing first. And then my head was going crazy. It's like, how do you not bill a claim for 11 months? I don't know. Anyway, I do this one because, once again, when I do these things, I'm doing them so that you know what to do if this happens to you. Nothing says you have to jump on it immediately, but always call the people who have generated this particular issue. See what their issue is, and if you know that you should be set, tell them so. Tell them to call the insurance company, or you call the insurance company, and you take care of it. That's what insurance is for. Anyway, that's what I have. My name is Mitch Mitchell. I hope y'all don't have to deal with stuff like this, but if you do, now you know how to do it. You take care.